As a responsible pet owner, ensuring the health and well-being of your dog is a priority. However, there are many hidden threats that can affect your furry friend, and one of the most common yet often overlooked concerns is worm infestations. Dogs, like humans, are susceptible to a variety of parasites that can cause significant health problems. These parasites, including worms, not only harm your dog's health but can also be transmitted to humans in certain cases. In this article, we will explore the types of worms that commonly affect dogs, the symptoms of worm infections, how to treat and prevent them, and why regular vet checkups are essential in keeping your dog healthy and happy. Dog worms are a diverse and complex group of parasitic organisms that infiltrate a dog's body, leading to various degrees of discomfort, malnutrition, and even life-threatening conditions. These parasites are broadly classified into internal and external categories, but the internal types, specifically roundworms, hookworms, tapeworms, and whipworms, are the most pervasive and impactful on canine health. Roundworms, known scientifically as Toxocara canis and Toxoscaris leonina, are among the most common internal parasites affecting dogs. These worms are often transmitted through the ingestion of infected feces or contaminated soil, but puppies can also acquire them directly from their mother via the placenta or milk. Once inside the dog's body, roundworm larvae migrate through the liver and lungs, eventually settling in the intestines, where they mature and reproduce. This migration can cause respiratory symptoms such as coughing, particularly in young puppies. The adult worms feed on partially digested food in the intestines, depriving the dog of essential nutrients. Dogs with heavy infections may exhibit a pot-bellied appearance, poor coat condition, stunted growth, and gastrointestinal disturbances like diarrhea or vomiting. A vivid example is a litter of puppies rescued from a neglected environment, showing severe bloating, poor appetite, and lethargy, all classic signs of roundworm infestation. Deworming treatments with medications such as parental pomote or fenbendazole are crucial in eliminating the parasites and restoring the puppy's health. Hookworms, primarily Ancylostoma caninum and Uncinnaria stenocephala, are smaller but more aggressive parasites. Unlike roundworms, they attach to the intestinal lining and feed on the dog's blood, leading to anemia, especially in puppies and immunocompromised dogs. Hookworm larvae can penetrate the skin, typically through the paws, or be ingested from contaminated environments. Once inside, they travel to the lungs, are coughed up, swallowed, and finally establish themselves in the small intestine. Dogs with hookworm infestations may display signs of weakness, pale gums, weight loss, and dark, tarry stools due to gastrointestinal bleeding. In severe cases, puppies may collapse from acute anemia, requiring urgent veterinary intervention and blood transfusions alongside anthelmintic treatment. An illustrative case is that of a young stray dog found lethargic and severely underweight, diagnosed with hookworms through fecal flotation and successfully treated with a combination of anthelmintics and supportive care. Tapeworms, particularly Dipylidium caninum and Taenia species, have a unique mode of transmission involving intermediate hosts such as fleas or small prey animals. Dogs typically acquire tapeworms by ingesting infected fleas during grooming or by consuming raw meat or prey harboring the parasite. The tapeworm segments, known as proglottids, are shed in the dog's feces and resemble small rice grains. These segments contain eggs that, once ingested by an intermediate host, continue the life cycle. Clinically, dogs with tapeworm infections may exhibit scooting behavior due to irritation around the anus, mild weight loss, and, occasionally, gastrointestinal upset. A notable example involves a pet dog frequently allowed outdoors and observed dragging its rear on the carpet. Examination revealed tapeworm segments around the anus, leading to a confirmed diagnosis and treatment with praziquantel, alongside flea control measures to prevent reinfection. Whipworms, or Trichuris vulpes, inhabit the cecum and colon, where they embed their thin, whip-like anterior ends into the mucosal lining. This action causes irritation, leading to chronic diarrhea, weight loss, and general poor condition. Whipworm eggs are exceptionally resilient, capable of surviving in the environment for years, making reinfection a persistent challenge. Dogs with whipworm infections may present with intermittent diarrhea, sometimes containing blood or mucus, and progressive weight loss despite maintaining a reasonable appetite. A compelling case is that of an adult dog with a history of chronic, unexplained diarrhea, eventually diagnosed with whipworms after multiple negative fecal tests. The diagnosis was confirmed through a fecal antigen test, and treatment with fenbendazole, along with environmental sanitation, resolved the symptoms. Each type of internal worm poses unique challenges, from their transmission pathways to their clinical manifestations and treatment approaches. The impact on a dog's health varies depending on factors such as age, immune status, and the severity of the infestation. Early diagnosis and targeted deworming protocols are essential to mitigate these parasitic threats. Regular veterinary checkups, combined with routine fecal examinations and preventive measures like monthly broad-spectrum dewormers, help maintain a dog's overall well-being and prevent the recurrence of infestations. The complexity of dog worm infections underscores the importance of understanding each parasite's life cycle, behavior, and clinical consequences to ensure effective management and improved canine health outcomes. Roundworms, specifically Toxocara canis, represent one of the most prevalent and clinically significant parasitic infections in dogs, particularly affecting puppies but also seen in adult dogs under various conditions. These nematodes are characterized by their cylindrical, elongated, and spaghetti-like appearance, often visible in vomit or feces when infestations become heavy. Their life cycle, pathology, and the physiological toll on the host make them an essential focus in veterinary parasitology. Transmission of Toxocara canis occurs through multiple routes, which explains their widespread nature. The most direct route involves the ingestion of infective eggs from contaminated soil, food, or water. Dogs frequently explore their environment using their mouth, making it easy for eggs shed in feces to find a new host. A less direct but equally significant route occurs transplacentally. Infected mothers pass the larvae to their unborn puppies. This vertical transmission ensures that even newborns, without exposure to the outside world, can start life harboring roundworms. Additionally, puppies can acquire the infection through the mother's milk during nursing, further exacerbating early life infestations. Once ingested, the eggs hatch in the small intestine, releasing larvae that embark on a complex migratory journey through the dog's body. These larvae penetrate the intestinal wall, enter the bloodstream, and travel to the liver, from which they migrate to the lungs. In the lungs, larvae trigger inflammatory responses, leading to coughing and respiratory distress. Dogs may cough up and subsequently swallow the larvae, returning them to the gastrointestinal tract, where they mature into adults. This hepatopulmonary migration is particularly damaging to young puppies, whose developing respiratory and immune systems are ill-equipped to handle such an aggressive invasion. A vivid example is a litter of Labrador puppies from a shelter, presenting with persistent coughing and nasal discharge initially misattributed to kennel cough, only to later reveal roundworm larvae in tracheal wash samples, emphasizing the deceptive nature of early symptoms. In the intestines, mature roundworms consume partially digested food, depriving the host of critical nutrients. The consequences manifest in poor growth, weight loss despite a normal or increased appetite, and a distinctly bloated abdomen, a classic hallmark in heavily infested puppies. The distension results from the sheer volume of worms and gas buildup due to impaired digestion. Gastrointestinal upset, including vomiting and diarrhea, is also common. In one documented case, a German Shepherd puppy exhibited chronic vomiting with occasional expulsion of live worms, highlighting the severity of advanced infestations. Such presentations often lead to dehydration and electrolyte imbalances, compounding the puppy's deteriorating condition. Beyond physical manifestations, the immunological response to Toxocara canis is significant. The larval migration triggers eosinophilic infiltration, contributing to tissue damage and inflammation. Dogs may exhibit signs of general malaise, fever, and lethargy, with blood work revealing eosinophilia, an important diagnostic clue in suspected parasitic infections. Furthermore, larval migration does not always culminate in the intestines. Some larvae enter a dormant state, insisting within tissues such as the liver, lungs, and muscles. This arrested development can persist for months or even years, reactivating under conditions of stress or immunosuppression. For example, a senior beagle recovering from major surgery presented with acute respiratory signs, later traced to reactivated dormant larvae, illustrating how latent infections can resurface when a dog's immune defenses wane. The impact of roundworm infestation extends beyond the individual dog to public health. Toxocara canis is a zoonotic parasite, capable of infecting humans, particularly children, through accidental ingestion of eggs. The resulting condition, known as visceral larva migrans, involves larvae migrating through human tissues, causing inflammation and, in severe cases, ocular larva migrans, leading to vision impairment or blindness. This zoonotic potential underscores the importance of routine deworming, not only for the dog's health but also for reducing environmental contamination and protecting human households. Treatment for roundworm infections primarily relies on anthelmintic medications such as parental pomote, fenbendazole, or milbemycin. These drugs target adult worms in the intestines, but repeated treatments are necessary to address emerging larvae from migrating or encysted stages. For instance, a golden retriever puppy from a rescue group underwent a multi-stage deworming protocol, with fecal examinations at intervals revealing progressively fewer eggs until clearance was achieved. This case demonstrates the importance of follow-up treatments to ensure complete eradication of the parasite. Preventive strategies are equally crucial. Routine deworming schedules, starting as early as 2 weeks of age, help curb early infestations. Additionally, controlling environmental contamination by promptly disposing of feces and implementing hygiene measures reduces the risk of reinfection. In a community-based veterinary outreach program, consistent deworming and public education led to a marked decrease in Toxocara egg contamination in local parks, highlighting the broader benefits of proactive management. Roundworms exemplify the intricate interplay between parasitic biology, host physiology, and environmental factors. Their ability to exploit multiple transmission routes, establish tissue-dwelling larvae, and induce systemic disease makes them a formidable threat to canine health. Understanding their life cycle, pathology, and the nuanced clinical presentations they produce is essential for effective diagnosis, treatment, and prevention in veterinary practice. Hookworms, particularly Ancylostoma caninum and Uncinnaria stenocephala, are among the most insidious internal parasites affecting dogs, capable of inflicting profound harm due to their blood-feeding nature. Unlike many other intestinal worms, hookworms possess specialized mouthparts, including cutting plates or teeth, which allow them to firmly attach to the intestinal mucosa and lacerate blood vessels. This results in continuous blood loss, which can rapidly lead to anemia, particularly in puppies and debilitated adult dogs. Their ability to shift feeding sites further exacerbates the damage, leaving behind bleeding ulcers in the intestinal lining. The life cycle of hookworms is particularly aggressive and versatile. Transmission can occur through several routes: ingestion of infective larvae from contaminated soil, skin penetration typically through the paws or belly when a dog lies on infested ground, and transmammary transmission from mother to nursing puppies. This multifaceted transmission strategy ensures widespread infection. Once larvae enter the body, they migrate through the tissues to the lungs, where they are coughed up and swallowed, eventually establishing themselves in the small intestine. This process of tissue migration can induce coughing and mild respiratory symptoms, which may be mistaken for respiratory infections in early stages. A striking example of this life cycle's efficiency involves a litter of border collie puppies presented to a veterinary clinic with profound lethargy, pale mucous membranes, and bloody diarrhea. Despite deworming at birth, the puppies were later found to have acquired hookworm larvae from their contaminated bedding. Fecal flotation confirmed the presence of ancylostoma eggs, highlighting the resilience of environmental contamination and the importance of rigorous sanitation. The clinical signs of hookworm infestation stem directly from their blood-feeding behavior. Dogs, particularly young puppies, may exhibit severe anemia characterized by pale gums, weakness, and lethargy. Affected animals often become reluctant to play or engage in normal activities, appearing listless and depressed. The anemia can progress to tachycardia, increased heart rate, and labored breathing as the body struggles to compensate for reduced oxygen carrying capacity. Diarrhea, often dark and tarry due to digested blood melena, is another hallmark symptom. In chronic cases, malnutrition and weight loss become evident, even when the dog maintains a normal appetite. An illustrative case involved an adult mixed-breed dog from a rural area, initially brought in for unexplained weight loss and poor coat condition. Blood work revealed microcytic, hypochromic anemia, a classic sign of chronic blood loss, and fecal analysis confirmed hookworm ova. The dog required iron supplementation and multiple rounds of broad-spectrum anthelmintics to achieve clinical recovery. Beyond the gastrointestinal tract, the systemic effects of hookworm infestations can be profound. Puppies with severe anemia may suffer from hypoproteinemia, leading to fluid buildup in the abdomen, ascites, and subcutaneous tissues, edema. These puppies often display a pot-bellied appearance, though unlike the bloating seen in roundworm infections, this distension is due to fluid rather than worms themselves. In extreme cases, hookworm infections can precipitate hypovolemic shock and death if not promptly treated. A tragic example comes from a veterinary outreach mission where a Malinois puppy was found collapsed in a rural field. Despite immediate deworming and supportive care, the severe blood loss proved irreversible, a sobering reminder of the parasite's lethality when left unchecked. Hookworms also exhibit a unique ability to engage in larval leak syndrome, where dormant larvae encyst in tissues and periodically emerge to repopulate the intestine. This phenomenon complicates treatment, as standard deworming regimens may clear adult worms while leaving dormant larvae intact, leading to recurrent infections. A documented case involved a senior golden retriever that presented with intermittent bouts of diarrhea and anemia despite regular deworming. Advanced diagnostics, including serology and fecal antigen tests, revealed recurring ancylostoma infestations from tissue-resident larvae. This case underscores the importance of extended treatment protocols and vigilant monitoring in chronic hookworm cases. Environmental contamination is another major challenge in managing hookworm infections. Hookworm larvae thrive in warm, humid environments, making communal areas like dog parks, shelters, and poorly maintained yards high-risk zones. The larvae can survive in soil for weeks or even months, waiting for a suitable host. In one notable case study, a community dog park experienced a surge in hookworm cases among regular visitors. Environmental sampling confirmed heavy contamination with infective larvae, prompting park management to implement a temporary closure for soil treatment and public education on fecal hygiene. Treatment of hookworm infestations relies on anthelmintic medications such as parental pomote, fenbendazole, and milbemycin-oxime. However, supportive care is often necessary in severe cases, particularly those with significant anemia. Blood transfusions may be life-saving in profoundly anemic puppies, buying time for dewormers to take effect. Iron supplements, vitamin B12 injections, and high-protein, easily digestible diets support recovery. A compelling example involves a rescued pit bull puppy brought in after being found collapsed in an abandoned lot. The puppy received an emergency blood transfusion, followed by a comprehensive deworming regimen. Over the next month, the puppy made a remarkable recovery, gaining weight and developing a shiny, healthy coat, a testament to the resilience of dogs when provided with proper medical care. Preventive strategies are paramount to controlling hookworm infestations. Routine deworming, starting from 2 weeks of age and continuing at regular intervals, significantly reduces the risk of infection. Monthly heartworm preventatives that include hookworm coverage offer dual protection against both parasites. Maintaining clean living environments, promptly removing feces, and avoiding high-risk areas like contaminated soil further mitigate exposure. In a notable shelter-based study, implementing strict deworming protocols alongside improved sanitation reduced hookworm prevalence by over 80% within a year. Hookworms, with their versatile transmission routes, blood-sucking pathology, and ability to establish persistent infections, represent a formidable challenge in canine parasitology. Understanding their biology, clinical impact, and treatment intricacies is crucial for safeguarding dog health, and, given their zoonotic potential, for protecting human health as well. The fight against hookworms extends beyond individual cases to community-level prevention and education, ensuring healthier lives for dogs and their owners alike. Tapeworms, specifically Dipylidium caninum, represent a unique challenge among canine intestinal parasites due to their distinctive segmented structure and indirect life cycle. Unlike nematodes such as roundworms or hookworms, tapeworms require an intermediate host to complete their life cycle, most commonly fleas. When a dog ingests an infected flea during grooming or biting at itchy skin, the immature tapeworm cysts, known as cysticercoids, are released in the dog's digestive tract. These cysts then mature into adult tapeworms that anchor themselves to the intestinal wall using specialized hook-like mouthparts located on the scolex, or head. The body of the tapeworm consists of numerous segments called proglottids, each containing reproductive organs. As the worm matures, the segments break off and are passed in the dog's stool. These segments, often described as resembling grains of rice, are a hallmark sign of tapeworm infection and may be found around the dog's anus or in bedding. Clinical manifestations of tapeworm infections in dogs are often subtle but can escalate depending on the worm burden. One of the most common symptoms is pruritus around the anus, causing dogs to scoot along the floor in an attempt to relieve the irritation caused by the passing proglottids. Weight loss may occur, particularly in severe infestations where the worms compete with the dog for nutrients. In some cases, dogs exhibit mild gastrointestinal disturbances, such as intermittent diarrhea or changes in appetite. An illustrative case involved a young Cocker Spaniel presenting with persistent scooting and a patchy, dull coat. Upon fecal examination, tapeworm segments were confirmed, and subsequent flea control measures revealed a heavy flea infestation in the household. This case underscores the interconnected nature of tapeworm infections and flea control. Moving to another significant intestinal parasite, whipworms Trichuris vulpes inhabit the large intestine and cecum of dogs, anchoring themselves into the mucosal lining. Their slender, whip-like shape, with a thin anterior end and a thicker posterior end, facilitates their ability to burrow into the tissue and cause localized inflammation. The whipworm life cycle begins when a dog ingests infective eggs from contaminated soil, water, or feces. The eggs hatch in the small intestine, and larvae migrate to the large intestine, maturing into adults. This life cycle is notable for its prolonged prepatent period, up to 3 months, before eggs reappear in the feces, which can complicate early diagnosis. Clinical symptoms of whipworm infections can vary in severity, often depending on the parasite load. Mild infections may be asymptomatic, while heavier burdens lead to chronic, mucus-laden diarrhea, weight loss, and anemia due to blood loss from the damaged intestinal lining. A classic presentation involves a middle-aged beagle with chronic, intermittent diarrhea unresponsive to standard treatments. Fecal flotation initially showed no parasites, but a repeat test after 3 months revealed Trichuris vulpes eggs, highlighting the challenge of early detection. The inflammation caused by whipworms can mimic inflammatory bowel disease (IBD), necessitating a thorough diagnostic workup in chronic gastrointestinal cases. Dogs with severe whipworm infections may also exhibit signs of electrolyte imbalances, such as hyponatremia, a hallmark of the pseudo-Addison's syndrome seen in advanced cases. Heartworms Dirofilaria amitis, unlike the gastrointestinal parasites discussed earlier, occupy a far more critical anatomical region, the heart and pulmonary arteries. Transmitted through the bite of an infected mosquito, heartworm larvae microfilariae enter the dog's bloodstream and migrate through the tissues, eventually reaching the heart and lungs, where they mature into adults. This migration and maturation process can take approximately 6 months. Adult heartworms, which can grow up to 30 centimeters in length, physically obstruct blood flow and cause direct mechanical and inflammatory damage to the pulmonary vasculature. The clinical consequences of heartworm disease are profound. In the early stages, dogs may remain asymptomatic, with only subtle signs like occasional coughing or fatigue after exercise. As the disease progresses, more pronounced respiratory signs emerge, including persistent coughing, exercise intolerance, and labored breathing. The physical burden of worms in the heart can lead to right-sided heart failure, characterized by ascites, fluid buildup in the abdomen, jugular vein distension, and lethargy. A memorable case involved a 6-year-old Labrador retriever showing signs of exercise intolerance and a chronic cough. Radiographs revealed an enlarged heart and tortuous pulmonary arteries, classic signs of advanced heartworm disease. Antigen testing confirmed the diagnosis. Despite aggressive treatment with melarsoline, the dog's prognosis remained guarded due to the severity of cardiopulmonary damage. Heartworm prevention remains paramount, given the complexity and risks associated with treatment. Monthly prophylactic medications containing macrocyclic lactones, such as ivermectin or moxidectin, effectively prevent larvae from maturing. An annual heartworm test is recommended even for dogs on preventatives, as missed doses or resistance could lead to breakthrough infections. Community-wide mosquito control measures further reduce transmission risk, especially in endemic regions. Each of these parasites, tapeworms, whipworms, and heartworms, presents a distinct challenge in canine health. Their life cycles, pathogenic effects, and clinical manifestations vary significantly, necessitating tailored diagnostic, treatment, and prevention strategies. Veterinary awareness and owner education remain crucial to mitigating the impact of these formidable parasites on canine well-being. The symptoms of worm infections in dogs present a complex interplay of factors, including the type of parasite involved, the severity of the infestation, and the individual dog's immune response and overall health. Some dogs, particularly those with robust immune systems or lower parasite loads, may remain asymptomatic for extended periods, harboring the infection without showing overt signs. However, as the burden increases or the dog's health deteriorates, clinical manifestations emerge, reflecting the parasite's effect on different organ systems. Vomiting and diarrhea are among the most frequently observed symptoms across various worm infestations, driven by the irritation and inflammation of the gastrointestinal tract. Roundworms, for instance, often provoke vomiting in puppies due to their sheer size and abundance, with worms sometimes expelled directly in the vomit, a disturbing but diagnostic finding. Hookworms, on the other hand, induce bloody, tarry diarrhea as a result of their feeding habits, which involve latching onto the intestinal lining and causing microhemorrhages. An illustrative case involved a German Shepherd puppy presenting with repeated vomiting, accompanied by a foul-smelling, dark diarrhea. Fecal analysis confirmed the presence of Ancylostoma caninum eggs, highlighting the gastrointestinal trauma induced by hookworms. Weight loss or failure to gain weight, particularly in young dogs, reflects the parasite's competition for nutrients or the damage inflicted on the intestines, which impairs nutrient absorption. Tapeworms, Diphylidium caninum, are notorious for robbing dogs of essential nutrients while maintaining a relatively low inflammatory profile, making the weight loss subtle and progressive. In one memorable case, a Labrador retriever with an insatiable appetite continued to lose weight despite increased food intake. Proglotted segments were later discovered in his feces, confirming a tapeworm infection. The resolution of symptoms post-treatment demonstrated how efficiently tapeworms can disrupt nutrient balance. Lethargy and weakness arise when the parasitic burden leads to systemic energy depletion, often compounded by anemia. Hookworms, which extract blood from the intestinal lining, can cause profound anemia, especially in puppies or immunocompromised dogs. A litter of golden retriever puppies brought to a clinic exemplified this, as they were found lethargic, weak, and reluctant to nurse. Blood work revealed low red blood cell counts, and fecal analysis confirmed hookworm ova. The combination of deworming, iron supplementation, and supportive care led to a slow but complete recovery, underscoring the insidious role anemia plays in worm-related weakness. A swollen abdomen or bloated stomach is particularly characteristic of roundworm infestations, where large numbers of adult worms occupy the small intestine, causing mechanical obstruction and gas buildup. Puppies, in particular, may develop a pronounced, pot belly, appearance. This was observed in a young mixed-breed puppy adopted from a shelter, initially suspected of overfeeding. Upon examination, the puppy was found to be underweight beneath the bloated belly, and ultrasound imaging revealed a mass of intertwined roundworms. Deworming led to the expulsion of large numbers of adult worms, rapidly resolving the distension. Itchy anus or visible worms in the stool are hallmark signs of tapeworm infections. The migrating proglotted segments, which contain eggs, trigger irritation as they move from the rectum to the external environment. Dogs often scoot, dragging their rear across the floor, to alleviate the discomfort. A particularly vivid example involved a Cocker Spaniel brought in for persistent scooting and restlessness. Examination of the fur around the anus revealed several rice-like tapeworm segments. The dog's discomfort resolved promptly after anthelmintic treatment and flea control measures to prevent reinfection. Coughing, difficulty breathing, or nasal discharge are classic signs of heartworm disease, though they may also emerge in roundworm infections if larvae migrate to the lungs. Heartworms, Dirofilaria amidis, inhabit the pulmonary arteries and heart, causing progressive pulmonary hypertension and respiratory distress. A Doberman pinscher presented with chronic coughing and exercise intolerance was initially misdiagnosed with bronchitis. Subsequent heartworm antigen testing confirmed an advanced heartworm burden, with radiographs showing enlarged pulmonary arteries and right-sided heart enlargement. The case illustrated how heartworms compromise both respiratory and cardiovascular functions, ultimately leading to heart failure if untreated. Pale gums or abnormal blood tests are strong indicators of anemia, often associated with hookworm infections or severe parasitic burdens. Pale mucous membranes signal reduced oxygen delivery due to low red blood cell counts, and blood work may reveal microcytic, hypochromic anemia indicative of chronic blood loss. A senior beagle with unexplained fatigue and a reluctance to exercise exhibited marked pallor of the gums. Complete blood count analysis confirmed anemia, and fecal examination detected hookworm ova. The dog's improvement after deworming and iron supplementation highlighted how anemia, though not immediately obvious, can be a life-threatening consequence of parasitic infections. Worm infestations, while varied in presentation, consistently disrupt the dog's normal physiology, often with systemic consequences. The diversity in symptoms reflects the unique pathogenic mechanisms of each worm species, whether through nutrient theft, blood loss, tissue damage, or immune response manipulation. Prompt veterinary intervention remains crucial, as early detection and targeted treatment not only alleviate suffering but also prevent complications that may irreversibly damage a dog's health. Diagnosing worm infections in dogs is a multifaceted process that combines clinical observation, laboratory analysis, and advanced imaging techniques. The diversity of parasites, each with unique biological behaviors and tissue tropism, necessitates a tailored diagnostic approach. A veterinarian's first step often begins with a thorough physical examination. This involves evaluating the dog's body condition, coat quality, gum color, and abdominal palpation to detect signs like bloating, pain, or irregular masses. While physical signs may hint at parasitism, definitive diagnosis relies on more specific diagnostic methods. Fecal examination remains a cornerstone of parasitic diagnosis, particularly for gastrointestinal worms like roundworms, hookworms, whipworms, and tapeworms. A small fecal sample undergoes microscopic analysis, typically using techniques such as fecal flotation or centrifugation. The goal is to isolate and identify eggs, larvae, or adult segments, each bearing distinct morphological characteristics. Roundworm eggs, for example, exhibit a thick, rough shell, while hookworm eggs appear thin-walled and oval. Tapeworm segments, when fresh, may resemble rice grains visible to the naked eye. An intriguing case involved a border collie suffering from persistent diarrhea and weight loss. Initial fecal analysis appeared negative, but a repeated centrifugal flotation detected whipworm eggs, a testament to the intermittent shedding patterns of Trichuris vulpes. This highlights the need for repeated testing in suspected cases. Blood tests play a pivotal role, especially in diagnosing heartworms Dirofilaria amitis. The most common method involves detecting heartworm antigens, proteins released by adult female worms, through an enzyme-linked immunosorbent assay, ELISA. This test is highly specific but may yield false negatives in early infections or male-only infestations. To complement antigen testing, microfilariae detection via blood smear or modified Knott's test may confirm the presence of circulating larvae. An illustrative case involved a boxer presenting with persistent coughing and exercise intolerance. The antigen test returned negative results, but a blood smear revealed microfilariae, prompting further imaging, which confirmed heartworm-associated pulmonary pathology. This case underscores the importance of combining multiple tests to avoid false reassurance. In cases where physical signs and lab tests raise suspicion but fail to provide a clear diagnosis, imaging techniques like ultrasound and X-rays become indispensable. Radiographs are particularly useful for heartworm disease, where they may reveal an enlarged right heart, tortuous pulmonary arteries, or signs of pulmonary fibrosis, indicative of advanced heartworm burden. Ultrasound, on the other hand, excels at visualizing heartworm movements within the heart chambers or vena cava. A memorable case involved a Great Dane exhibiting jugular vein distension and ascites. Radiography displayed a characteristic, reverse D, heart silhouette, while ultrasound confirmed live adult worms within the pulmonary artery. This combination of imaging modalities cemented the diagnosis, guiding life-saving intervention. Endoscopy represents a more specialized, though less commonly employed, diagnostic tool. It is particularly useful when parasites are suspected in the upper gastrointestinal tract or respiratory system. A flexible endoscope equipped with a camera allows direct visualization of the esophagus, stomach, and upper intestines. This method becomes invaluable in chronic, unexplained vomiting cases where traditional fecal tests yield no results. A fascinating case involved a young terrier with severe, unrelenting vomiting and weight loss despite multiple negative fecal exams. Endoscopic exploration revealed a live Physioptera worm, a stomach parasite often missed on routine tests. The worm was successfully extracted during the procedure, leading to complete resolution of symptoms, a testament to endoscopy's diagnostic and therapeutic potential. Each diagnostic technique offers unique insights, but no single test is infallible. The variability in parasite life cycles, egg shedding patterns, and host immune responses necessitate a layered approach. Veterinarians must integrate physical findings with laboratory and imaging results, recognizing that some infections may present atypically or remain latent until advanced stages. Prompt, accurate diagnosis remains paramount to prevent long-term organ damage, ensure effective treatment, and protect canine health from the insidious effects of parasitic infections. Treating worm infections in dogs requires a comprehensive approach tailored to the specific type of parasite, the severity of the infestation, and the dog's overall health status. The goal is not only to eliminate the worms but also to address the damage caused, prevent reinfection, and support the dog's recovery. Deworming medications form the backbone of treatment for most intestinal worms, including roundworms, hookworms, whipworms, and tapeworms. These medications, known as anthelmintics, target the worms in different ways. For example, parental pomote acts as a neuromuscular blocking agent, causing paralysis in roundworms and hookworms, which are then expelled through the feces. Fenbendazole works more broadly, disrupting the metabolic pathways of various worm species, including whipworms and certain tapeworms. Praziquantel, specifically effective against tapeworms, causes the worm's outer coating to disintegrate, leading to its digestion within the dog's intestine. A notable case involved a young golden retriever diagnosed with a heavy roundworm burden. After administering parental pomote, the dog expelled large, spaghetti-like worms within hours, illustrating the rapid action of the medication. Follow-up doses were necessary to eliminate newly hatched larvae, emphasizing the importance of repeated treatments. Heartworm treatment is far more complex due to the worm's location within the heart and pulmonary arteries, making elimination risky. The standard protocol involves a multi-step regimen beginning with stabilizing the dog's condition. This often includes corticosteroids to reduce inflammation, antibiotics like doxycycline to weaken the Wolbachia bacteria symbiotically associated with heartworms, and heartworm preventatives to stop further infection. The primary treatment uses melarsoamine dihydrochloride, an arsenic-based drug administered through deep intramuscular injections into the lumbar muscles. This kills adult heartworms gradually to minimize the risk of embolism. A compelling case involved a Labrador retriever presenting with severe exercise intolerance and coughing. Radiographs confirmed heartworm disease. After months of meticulous treatment, including restricted activity to prevent fatal complications, the dog showed significant improvement. In rare cases with a heavy worm load causing life-threatening blockages, surgical removal through a jugular vein incision may be necessary. An extreme example involved a Doberman with Caval syndrome, a condition where worms obstruct blood flow through the heart. Surgery successfully removed over 30 worms, immediately relieving symptoms. Preventing reinfection is just as critical as the initial treatment. For tapeworms, flea control is paramount since fleas serve as intermediate hosts. Without controlling fleas, treating tapeworms alone leads to a vicious cycle of reinfection. Topical treatments like selamectin, oral tablets like afoxolaner, and long-lasting collars containing flumethrin are effective in killing fleas at various life stages. One case of repeated tapeworm infestations in a beagle highlighted the importance of flea control. Despite successful deworming with praziquantel, the dog continued to pass tapeworm segments. A thorough environmental flea control plan, including treating the dog in its bedding, finally stopped the cycle. This example underscores the interconnectedness of external parasites and internal worms. While medications remain the cornerstone of treatment, supportive care plays a crucial role in helping dogs recover from the damage caused by worms. Dogs suffering from severe anemia due to hookworms may require blood transfusions alongside deworming. A poignant case involved a litter of puppies, heavily infested with hookworms, presenting with pale gums and profound lethargy. After emergency transfusions and deworming, all but one recovered, a sobering reminder of how deadly worms can be without timely intervention. The diversity of worm species, each with its unique life cycle, feeding behavior, and preferred tissue environment, demands an equally nuanced and adaptable approach to treatment. From rapid-acting dewormers targeting intestinal worms to prolonged, carefully managed heartworm protocols, veterinary medicine offers a robust arsenal to combat parasitic infections. However, effective treatment extends beyond medication alone, integrating prevention strategies to safeguard against reinfection and ensure lasting health for dogs. Preventing worm infections in dogs is a multifaceted effort that relies on a combination of proactive veterinary care, environmental management, and consistent parasite control. Each aspect of prevention targets different stages of a worm's life cycle, ensuring dogs remain protected from both internal and external parasites. Regular deworming remains one of the most effective preventative strategies. Puppies, being highly susceptible to roundworms and hookworms through maternal transmission, require an early deworming schedule starting as young as 2 weeks old, repeated every 2 weeks until they reach 12 weeks of age. This aggressive regimen interrupts the life cycle of worms that might have been passed through the mother's milk or placenta. For adult dogs, the schedule typically shifts to every 3 to 6 months, tailored to the dog's lifestyle and risk exposure. For instance, a rural border collie frequently exposed to wildlife and contaminated soil might require more frequent deworming than an urban companion dog with minimal outdoor access. This approach ensures that any larvae or immature worms that evade the immune system are regularly expelled before they mature and cause harm. Flea and tick control is indispensable, particularly for preventing tapeworm infestations. Tapeworms rely on fleas as intermediate hosts, and dogs inadvertently ingest these fleas during grooming. Comprehensive flea prevention, therefore, disrupts this transmission route. Products like Floralaner, which provides long-lasting flea and tick protection for up to 12 weeks, offer a practical solution for owners who may struggle with monthly applications. In a notable case, a Labrador Retriever suffering from chronic tapeworm infestations despite repeated deworming was finally cleared after his environment was treated for fleas and he was placed on a long-term oral flea preventative. This demonstrates how addressing the parasite's vector is just as important as eliminating the worm itself. Heartworm prevention is another critical pillar. Monthly preventatives containing ivermectin, milbemycin oxime, or moxidectin work by targeting heartworm larvae microfilariae before they mature into adult worms. This is especially crucial in regions with high mosquito populations, as mosquitoes are the primary vector for heartworms. In a humid, mosquito-heavy environment like the southeastern United States, a beagle mix that missed just 2 consecutive doses of heartworm preventative was diagnosed with early-stage heartworm disease. This case underscores the unforgiving nature of heartworm infections and how even brief lapses in prevention can lead to serious consequences. Maintaining a clean living environment for dogs minimizes their exposure to parasitic eggs and larvae. Roundworms, whipworms, and hookworms shed eggs in feces, which can persist in soil for months to years. Promptly picking up feces, especially in communal dog parks or backyard spaces, reduces the environmental burden of infectious stages. Moreover, avoiding stagnant water, a breeding ground for mosquito larvae and a potential reservoir for Giardia and other protozoal parasites, further supports prevention efforts. A striking example involved a group of rescue dogs housed in an overcrowded shelter with poor sanitation. Multiple dogs presented with severe whipworm infections. After extensive cleaning protocols, including disinfecting enclosures and improving drainage to prevent standing water, reinfection rates dropped dramatically, highlighting the environment's role in sustaining parasite cycles. Routine veterinary checkups complement these preventative measures by providing early detection and tailored interventions. Fecal examinations, ideally performed 1 to 2 times a year, can reveal microscopic worm eggs or larvae even before clinical signs emerge. Additionally, annual heartworm testing ensures that prevention remains effective, especially since no preventative is foolproof. A noteworthy example involves a senior Shih Tzu brought in for routine blood work. Though asymptomatic, the dog tested positive for whipworm eggs during a fecal test. Early detection allowed for swift treatment, preventing the weight loss and bloody diarrhea often associated with advanced whipworm infections. Preventing worm infections is an ongoing commitment that requires vigilance, consistency, and an understanding of parasite biology. Each layer of prevention, deworming, flea and tick control, heartworm medication, environmental management, and veterinary oversight, serves as a safeguard, reinforcing the others. The interconnectedness of these strategies ensures dogs remain protected from the persistent threat of parasitic worms, preserving both their health and quality of life. Worm infections in dogs are a common but preventable health issue. By understanding the different types of worms, recognizing the symptoms, and knowing how to treat and prevent these infections, you can help ensure your dog's health and quality of life. Regular veterinary care, proper prevention protocols, and timely treatment can protect your dog from the dangers of worms. Remember, the sooner you detect and treat a worm infestation, the better the outcome for your pet. If you found this article helpful, be sure to explore our other informative videos and articles on pet health. We have a wealth of content designed to help you keep your furry friend in top shape. Stay tuned for more tips and tricks on caring for your dog.